Geeta, 1 minute. Recording started. Please start.
Ma'am, the full screen it is not showing, right?
Madam will make it.
Okay. Om Dhanvantare Namaha. Good afternoon, dear all Vaidyas. Today I am hosting 42nd webinar. We are successfully completed last month workshop. 2 days workshop we are successfully completed. I think most of the Vaidyas got benefited from that. Some disturbances are there. Please, I request everyone to mute the gadgets. Dr. Kanchana, mute the gadget. We got a very good response from the workshop, 2 days workshop. I think everybody are benefited with that. We got a very good response and reviews also. Hope we may conduct in future such type of workshops also. Today, I think we are going to start the session with prayer by Dr. Kanchana. Dr. Kanchana,
Yeah.
over to you.
Thank you,
One.
Shakunta ma'am. Thank you.
Ranjini ma'am, will you make it full screen?
Yeah. Thank you, Dr. Shakunta ma'am. Thank you, Dr. Geeta. Om Namami Dhanvantari Adidevam Surasiraivam Tapadapatmam Loke Jalarupayam Mrityunashanam Dhataramisham Vedoshadhinam Dhanvantari Ramanakam Sarvaruganivarakam Ayurveda Pravaktaram Vande Piyushadayakam Sarve Janaha Sukhino Bhavantu Om Shanti Shanti Shanti.
Thank you, Dr. Kanchana. Now I request our founder, Dr. Shakuntala Madam, to brief about RAAUOS Group. Over to you, ma'am.
Thank you, Dr. Geeta. Om Shri Dhanvantare Namaha. I wholeheartedly welcome Dr. Ranjini ma'am to accept our invitation and came here for sharing her knowledge. Thank you so much, ma'am, and welcome to the RAAUOS webinar.
Sure.
And we all know sharing is caring. Through this caring, so RAAUOS webinars are conducting because to share the knowledge and build a network in between all the Ayurvedic Vaidyas to get what exactly happening in our system of medicine towards the cancer treatment, because many of are unaware that we are having cancer treatment, and that too in final stage also, and in the initial stage also we can prevent also. So all these because of all these thoughts, this RAAUOS webinar, RAAUOS trust has started 4 years back. RAAUOS is, as name suggests, RAAUOS is Rudra Arbuda Ayurveda approach under one shelter. So here we are conducting some of the activities through our admins team. So this is not I have started team, but through it admins team we are doing wonderful work, like we are doing awareness programs. So as we all know, Dinacharya and Rutucharya is the basic lifestyle to manage, to avoid all the diseases, Swasthasya Swastharakshanam, through Dinacharya and Rutucharya. So by we are conducting this awareness programs, we are telling these facts only in the awareness programs to conquer the cancer, because nowadays we are getting lot of cases. And another thing, after starting this RAAUOS team, I am getting many queries from all my teammates, and even from apart from other states also, because our team is having 16 more than 16 state participant and more than 650 members of RAAUOS team members. and many experts are there in the team, and many learners are there in the team, and many gurus are there in the team. Why I'm telling you this word guru means, because when we are conducting two classes on Monday, we are exclusively conducting one class regarding yoga only. We are following Rasatantra Sara Vasiddha Prayoga Sangraha, where many gurus are coming and sharing their knowledge towards one yoga, and we are learning that Rasatantra Sara. And Thursday classes is for only for cancer. I think since 1 year this kidney cancer is going on, still it is not ending, because routes are many. Regarding kidney cancer, and we are conducting rasashalas. We are preparing our own medicines. It has started since 2 years by the blessings of Koti Nagarjun sir and Surendra Sharma sir. When we met sir, because of them blessings, we have started since 2 years. We are making our own medicines, and we are conducting our screening camps regarding specially breast and oral and prostate cancer, and some of times, because pap smear if available, even cervical cancers also, we are doing the screening camps, and we are conducting educational programs. Like this, many more activities we are conducting, and with the help of admins team, we are doing. As Dr. Geeta said, we have done 2 workshops. This second workshop is like Champe, like tell no. So like that, it was so nice, because of so many gurus, speakers came all over from India. They have done very good job. I really thank all of them, and I thank all the delegates for joining this webinar to get the knowledge. I again welcome all of you to the ROS webinar. Thank you. Over Dr. Geeta.
Thank you, ma'am. And now I would like to request Dr. Rachna ma'am to introduce today's speaker. Dr. Rachna ma'am.
Namaste, Geeta ma'am.
Namaste,
Namaste, Dr. Ranjini ma'am. And also, thank you, Dr. Shakuntala Patil ma'am, for this opportunity. When I read about Madam, I remembered this Subhashitam which tells Ashwasya Bhushanam Vego Mattam Syat Ghaja Bhushanam Chaturyam Bhushanam Narya Udyogo Narabhushanam. That is, Chaturyam is Bhushana to Nari. The information given was endless. Like it was so inspiring. I felt Madam has to explain so many things in this. Like she has founded and conceptualized S.N. Pandit's Prabhashanam. So more than I can say, if she can explain it more, it would be really helpful to all of us. Now, this is just a brief introduction about Dr. Ranjini Karthik Pandit. She has completed her BMS in the year 2002 from GMC Bangalore, and Masters from GMC Mysore in the year 2011. And she has worked as Ayurvedic consultant at Kotakal Ayurveda Bangalore, and she has worked as senior Ayurveda physician at Manna Ayurveda Center Bangalore, and as senior physician at Healthway Ayurveda Center. She is technical director at SN Pandit and Sons at Mysore now, and also she is partner and consultant at SN Pandit Healthcare Services Mysore, and she has founded and conceptualized SN Pandit's Prabhashanam in Ayurveda Finishing School, about which we would like to know more. And she is founder and chief physician at SN Pandit Arogya Siri Ayurveda Panchakarma Division. She is Saha Pramukh at Prantya Shaikshik Prakosht Bharatiya Shikshana Mandal. And to add to her achievements, she has presented a few research papers and presentation. Though there were many, I have taken few, highlighted few. A clinical study to evaluate the combined effect of Mustakarishta and Mahakalyanaka Kashayan Grahani with special reference to IBS associated with stress, critical analysis on Doshi Visha, and one more is understanding Prameha Samprapti with special reference to Rasa Raktadi Dhatus. She has been awarded with Dhanvantri Award by Lions Club Mysore East, and she conducts special camps on various topics, and also she is very much inclined towards series of talks on awareness regarding health, and Ayurveda. This is just a brief introduction, ma'am, and we are honored to have you here today. Thank you very much.
Thank you.
Thank you, Dr. Archana ma'am. I would like to request everyone to mute the gadgets to avoid the interruption. If any queries are there, they can post it in the chat box. I'll take in the end of the session. We'll clarify all the doubts. Hope so. Now I request Dr. Ranjana ma'am to start the session. Platform is yours, ma'am. Welcome you once again.
Yeah. Thank you. Thank you, organizers. And thank you for the introduction, what has been given by Dr. Rachana. And as she said, SN Pandit Prabhashanam is a finishing school where we are training the new, fresh doctors who have just finished BAMS or post-graduation and yet to get into the practice. So we train them the clinical skills or soft skills of Ayurveda, and we teach them how to get into the practice. And even though they don't have a setup, a Panchakarma setup, even at the OPD basis, what and all treatment they can plan, how to analyze the case, how to document the case, and how about a clinical presentation, as well as scientific writing, medical legal aspect, everything in a nutshell, we teach them. It is a almost around 100 credit course we do conduct every year with a minimum number of students. We don't take many students in this because we cannot have a one-to-one interaction. So usually I select around 5 to 8 students. We give a preliminary test, and once they cross that, we take them for the classes. And this is regarding Prabhashanam. This was founded in 2018. So till now, 8 to 9 batches of Prabhashanam students are there. So this is regarding Prabhashanam. And now jumping into the topic, thank you for the, I thank the organizers for providing this platform. Before beginning, I would just like to correct one small correction in the topic with the opinion, from the organizers. It was said that clinical experience in Ayurvedic cancer management. I just want to correct a small thing. It is not Ayurvedic cancer. Cancer is not Ayurvedic, cancer is not allopathic, cancer is not homeopathic. So cancer is cancer. Ayurvedic management of cancer.
Yes, ma'am. Thank you.
Yeah.
Thank you so much for
please don't mind. It's a small
No, ma'am.
correction.
No. Yeah.
Yeah.
Thank you.
Yeah. So, with the blessings of Lord Dhanvantari and salutations to all my gurus, I would like to begin my seminar. So, why I have written little steps towards managing cancer means whatever we are doing, in this current era, be it a conventional system or Ayurveda or any other medical system, nobody are yet to boast that, okay, we have conquered it. None of us, not even the conventional system. Even they are struggling. Only thing is they have just charted out, okay, we have to give 6 chemos, we have to give 6 radiotherapies, okay, and this is the lifespan. So we are unable to pull on the lifespan yet. So everybody are just taking a baby steps. We are toddling, everybody. Maybe they are like more, they are more documented and they have a protocol of management. So maybe that is the way, that is the reason, maybe they are like first looked upon. But that doesn't mean that Ayurveda is back. No, we are also in the same line. Even after doing so many chemos and so many radiotherapies, max to max, the life expansion may be 2 or 3 months extra. So there are some treatable cancers which is treatable in allopathy as well as in Ayurveda also. So the whole medical fraternity is still struggling to find a way to it. So that is that is the reason I have put little steps towards managing cancer. Okay, and here in this seminar, I don't like to correlate anything. Like let us assume cancer as cancer, and take the pratyatmaka lakshanas, means the presenting complaints will take and will try to manage through that. So many people, like what I have heard in many seminars, many have correlated cancer to arbuda, cancer to gulma, cancer to raktapitta. So many such things. Here, I don't want to use that type of assessment, because many times we land up in soup. Like we may not be able to go and hit the target if we try to correlate. We may, we may put a binding or we may put a boundary and the expansion might not happen in a proper way. So let us just assume, analyze the doshas, analyze the gunas, analyze the Panchamahabhuta, the dhatus involved, and doshavastha, rogavastha, and the sthana samshaya, the vector sthana or the nidanas based on this, and then try to contribute whatever we are able to do it and help the patient through this. So first, I would just like to give a brief introduction of the medicines what we generally use in cancer. I am a classical practitioner, so I seldom use some of the, proprietary medicines. So usually I go on to my classics only when I get, most of my cases are classical treated cases. So some of the medicines like Panchatikta Gugulu Grita, it is best in Asti Sandhi Vikara. And usually when we see the Phalashruti, he says Arbuda, Kushta, Nadivrana, Bagandhara, Gandamala, Gulma, Meha, Yakshma, Aruchi, Kasa, Shwasa, Pinasa, Shofa, Pandu, Vidradi, Vatarakta and Jatrudvagata Rogas. So even though Panchatikta Gugulu Grita is a Grita, it is an Apatarpaka Grita. Gugulu itself is a Lekana Dravya and a Shoshana Dravya. So usually what I feel in cancer cases, we have to think in the lines of apatarpana. So most of the drugs we usually select, or most of the practitioners who select, will be apatarpaka pradhana dravyas. So again, as it has a direct indication in Arbuda, Vidradi, Gandamala, Gulma, so usually most of the practitioners select Panchatikta Gugulugrita. And the next best selection will be Shivagutika. Again, this is also advised in Jwara, Yoni Shukra Dosha, that is Pliha, Arshas, Pandu, Grahani, Gulma. Again, see, you can see almost all similar indications. Arbuda, Vidradi, Yakrit, Prameha, Bhagandhara, Raktapitta. So wherein there is more of a complicated condition, more of a Yakshma-like symptoms. Yakshma is, here I am not telling about Raja Yakshma, I am speaking about the Roga Sankara. So usually in such cases where it is more depth, more Dhatu Gatavastha, such cases usually it is given. So next is Varunadi Kashaya. I usually select, that's a drug of my choice. So again it is Kapha Medohara. Kapha Medohara is once again Apatarpaka. So it is usually given in Mandagni, Adhyavata it has been indicated, Shirashula, Gulma and Vidrati. So Swarnamalini Vasanta is one of the best chosen Rasayana Dravya by me because it is Lekhana as well as Rasayana. And it is given in Kshaya, Jirna Jwara, Dhatugata Jwara, Vishama Jwara, Pliha, Vidradi, Yakrit Vikara, etc. And Indukanta Grita, again Kapha Pittahara, that one. So, and Vata Mayas, best in Vataja Vikaras, Kshaya, Udara, Gulma, Jwarahara and Balavardhana. And Trivanga Bhasma is one more thing, which is again a Rasayana as well as a Lekhana Dravya. So Madhumeha, Puyameha, Shukrameha and Bahumutrata and Vandya. So why I have selected these medicines and just told in beginning is because I have just like a permutation combination of these medicines have been used along with the Panchakarma procedures in the cases what I'll be dealing now. Any queries? Shall I continue?
Just a minute, ma'am. I request all the delegates to mute the gadgets. Sorry, ma'am. You can continue.
Yeah. Shall I continue?
Yes, yes.
Yeah. So this is the first case I've taken for discussion. A male patient aged 53 years approached with a pre-diagnosed condition of CA rectum. So this is the PET scan report I have put at the side. You can see there is a metastatic nodes in the bilateral, pararectal, mesorectal lymph nodes and enlarged hypodense necrotic presacral lymph nodes. All are likely metastatic nodes. He presented with Muhurbadha Muhurdrava Malapravriti and Muhur Malapravriti, which is a Pratyatmaka Lakshana of Grahani. So there was a problem with the both Samanavata, Pachaka Pitta, and Apanavata, as well as Grahana Shakti. So patient also complained of Mandagni. So when he approached, but he came with the pre-diagnosed condition. So once we see that, and we should not get like carried away. Okay, oh cancer, okay, only I have to treat with only these medications. It is better we always analyze the symptoms, then go back to the doshas, analyze the gunas, and then come to a conclusion. So as here, Mandagni was also there, and he had a lump mass in the rectal area. There was some kind of avarodha. So avarodha was also there, and grahani lakshanas were also there. So grahani is the one Agni. When the Agni is disturbed, it is always the grahani which is the first one to get affected. So patient underwent even with, see, this is a case which we treated parallelly because it was the histopathological report suggested that it's a mantle cell carcinoma, which is a very what to say, a potent type of cancer which has a highest chance of recurrence. So they were eager to go parallelly. So along with the chemotherapy, even the Ayurvedic therapies went parallelly. So he also complained of loose stools, fatigue, loss of appetite because of the chemotherapy, and developed low backache. So doing routine activities itself was very tough during the course. So Ayurvedic treatments were started in parallel with the conventional treatments. Initially, we started with Ashwagandhadi Rasayana and Purna Chandrodaya Makaradvaja. Even though these things are, what to say, Santarpaka, but to give some energy levels, to just hold the Rasadhatu in position, I started with Ashwagandhadi Rasayana and Purna Chandrodaya Makaradvaja, so that some energy was maintained in him. And again, Panchatikta Gugulu Grita was given in the Apana Kala. So along with the this one treatment. And Varunadi Kashaya 20 ml in the morning, 20 ml in the night before again in the Apana Kala was given. And Shivagutika 1 BD in the Vyana Kala was given for 1 month. So, and again, like further, along with the 5 set of chemotherapies based on the symptomatic management, Pitta Shekara Rasa was given. So, this Pitta Shekara Rasa is a composition of Sutta Shekara and Pradhana Arogya Vardhini. So, this actually reduces the, yes?
Hello, Shakuntala ma'am. Shakuntala ma'am. Hello, Shakuntala ma'am.
Yes, Geeta?
Please mute the gadgets.
I am muting them. I have muted.
Sorry, ma'am. Today I don't know
Please
why.
continue, ma'am.
Yeah.
Please.
Okay. Okay. So, as I said in the beginning, to control the Pachaka Pitta and as well as the Muhurdrava Lakshanas, we used Pitta Shekara Rasa, and wherein the Tikshnata of Pitta was reduced, and even the symptomatic management was given. And see, selection of Guduchadi Kashaya in this case was because it is also indicated in the Amashayagata Vrana. So even though this is not in the Amashaya, we can consider it as a Koshta, and so there is a Vrana. So in that concept, I selected Guduchadi Kashaya and 20 ml twice daily. It was continued for 6 months. So Guduchi, Padmaka, Rishta, Dhanyaka, Rakta Chandanihi. This is the ingredients of Guduchadi Kashaya. It is again Kafapitta Hara and Vrana Ropaka action. So this was given. And again for the general health, Atmagupta Churna and Ashwagandha Churna was mixed with milk, was given to reduce the fatigue. So again, when the patient complained of back pain, symptomatic management was done with the Trayodashanga Gugulu for low back pain, and Makaradvaja Gutika was given for severe fatigue. It is again a Siddha Makaradvaja composition. And when the patient had that incomplete evacuation, Triphala Churna was given once in the bedtime. So later, while treating along with this, because see, all the allopathic medicines or the medicines which are given in the cancer, it is again a hepatotoxic. So once in between, the patient developed nevus on the face. So that is because the medicines are hepatotoxic, and once the liver is challenged, you usually get that nevus. Maybe in the leg or hand or somewhere, you get that nevus. So once the patient developed that nevus, we started adding Patolakatrohinyadi Kashaya and Arogyavardhini to protect the Yakrit and Rakta. So specially concentrating on the Rakta Dhatu and Yakrit Vikara, we started on this. And after giving this for about 2 months, the nevus completely disappeared. After that, we planned one course of Matra Basti with Panchatikta Gugulugrita for 9 days, as the low back ache did not subside for the oral medications. So fatigue and pain, and I selected Matra Basti in this case because Kashaya Basti, like I was doubtful. I had not given any Kashaya Basti in such cases. And there are a lot of challenges, like when we have to plan Kashaya Basti. So here in this case, I wanted to be safe and I didn't try with the Kashaya Basti. I just took Pancha Tikta Gugulu Grita Matra Basti for 9 days. So after this, the fatigue and pain completely reduced to a very great extent. And we have the PET scan report subsequent, like from 28/8/21 to 6/6/24. There was a gradual reduction in the mass, as well as that metastatic nodes, everything got subsided. And you can see in the right hand side that report, everything is nil. Like the whole, see, no evidence of abnormal wall thickening or discrete mass involving the, 1 second. Yeah, involving the rectum is present in the study. Interval regression of previously noted upper mesorectal lymph node. So most of the inflammatory, metastatic nodes which were a question mark previous scan completely reduced. And now it is like, the last PET scan is on the June. On June it was taken. Even the oncologist, like we are doing it with a collaboration. Even the oncologist knows very well that the patient is on Ayurvedic treatment. And luckily, the patient is completely normal right now. But the only fear of mantle cell carcinoma is sudden recurrence. So the patient is still on the maintenance dose of Gugulu Panchatikta Grita. I am giving it continuously for once a day, like in the Apanakala, around 10 ml I am giving. And sometimes, suppose if the patient complains of some fatigue or something like that, we usually give along with some Ashwagandha Churna or Ashwagandha Adi Rasayana based on the condition. So this is the PET CT of the case, wherein it has completely subsided and patient is doing really good. And even the weight has increased. He had a huge weight loss. Even the weight has increased and patient is doing good. So the next case, it's a female patient aged 20 years, approached on 2/6/21 with a profuse hair fall since 1 week. This is a wonderful case because for a very long term, the patient did not reveal her previous condition. So hair fall was so profuse, the patient had become almost bald. In 20 years, if a patient approaches with so much of hair loss, the first suspicion goes like some underlying disease might be there. So this led to a suspicion of some underlying serious illness. Even after repeated inquiry, she did not reveal about her previous history. Literally, even after scolding nothing, she did not report. So I just asked her to get ESR and CRP done, which was pretty high. So one thing what we should consider is, we clinicians, if the ESR crosses 50, then alarm should be there in your mind. There is something really wrong. If the ESR crosses more than 50, either there is some autoimmune kind of pathogenesis happening in the body, or something similar to such cancerous condition. So this one simple test will reveal many, which leads to many other routes. And her CRP was 23.4. So we got a suspicion, like they are not just giving a proper history. So which led to further suspicion. So like even after pestering so much, when they don't reveal, we have to treat the case. So I just considered this as Doshi Visha and started with one course of Shodhana with regular Snehapana and Abhyanga and Shodhana. So after Shodhana, hair fall considerably reduced and ESR came down to 44. It is still high. And later I advised Bringasava and Narasimha Rasayana, which is again an indication for this Rasapradoshaja Vikaras, and Trifala Grita. Trifala Grita, which is for the Urdhva Chaturgata Vikaras and especially for treating the Kesha related, that scalp related issues and eye related issues. But one thing what we observed in this patient was her left eye was slightly protruded from the normal. When we visualize like in goiter how the eye protrudes, in similar way their left eye was protruded. And again on inquiry, they said it is like this since childhood. So again, like continuous thought process was going on in my mind, like she was having so much profuse hair fall and only one eye is protruded. So something was not very, what to say, not okay. There was something deficient in their information or something they are holding. Again, later her HP started falling. From 11 to, it came down to 7.3. Then when she started experiencing fatigue and when she started experiencing some other symptoms like Angamarda, all those things, then she slowly brought her old reports from 2018. And see, that too, we had to threaten her. Like I had to tell her, like, if you don't bring in the reports, then this is the end of the treatment. I will not touch you any further. So again, they got us all the report. So they had done PET scan, CT, everything was done because of her that protruded eye. So CT of the orbits revealed minimally enhancing thickening of the orbital and palpebral parts of the left lacrimal gland. First, they had suspected dacryoadenitis, but histopathological report suggested that lacrimal gland shows a florid B lymphocytic proliferation and a low-grade B-cell non-Hodgkin's lymphoma. And PET-CT, hypermetabolic soft tissue density in the extracorneal compartment of the left orbit. This has been like from past 3-4 years, they are roaming to every other doctor. And when it comes to biopsy, when the doctor suggests, when the oncologist suggests for biopsy, they used to change the doctor. Again, hide all the reports and keep roaming, keep jumping from one doctor to other. And she had hypermetabolic bilateral axillary right external iliac lymph nodes. And there was hepatomegaly also. So these are the reports. I think from, 2021, I have the report, and this PET scan report, I don't have the date. So in this PET scan, see, this is a patient of marginal zone lymphoma, and study shows active tissue lesion in the left lateral extracorneal compartment, and that is put in the report. And here you can see the lesion measuring 3.3 into 1.5 into 2.9 centimeters. So it was a pretty huge mass behind the eyeball, left eyeball, and a well-defined, moderately enhancing hyperdense lesion in the extracorneal compartment, it is said, suggestive of lymphoproliferative disorder. So from 10/8/21, we started the treatment for low-grade lymphoma. And she was advised again, Panchatikta Gugulu Grita. As I told you, it is an apatarpaka Grita. So I wanted to reduce that mass. So we started apatarpaka Grita. And again, Varunadi Kashaya was given. Guduchadi Kashaya was also given because of her severe hair loss. I wanted that Pitta Shamana to happen. So we started with Guduchadi Kashaya also. She had a history of repeated fever. So she was added Swarnamalini Vasanta. Swarnamalini Vasanta is indicated in most of the jwaras, and it is again a Lekana Dravya along with the Rasayana. So this was given one baby, and she complained of calf muscle tightness and pain, cramps, along with thigh and knee joints. So pain was so disturbing that her routine activities also, and movements were also restricted. So I advised Yogendra Rasa, which is a very best Vatahara line of treatment, and it acts as a muscle relaxant. So this gave slight relief. But again, it was not enough. So we planned Matra Basti with Panchatikta Gugulugrita. Why I selected again Panchatikta Gugulugrita is one, that mass, it is indicated in Arbuda. Again, it is indicated in Asti Majjagata Vikaras. And it is a Grita, so Vatahara. So based on all this analysis, we selected Matra Basti with the Panchatikta Gugulugrita. And this is the in-between report, well-defined, homogeneously enhancing abnormal signal intensity lesion in the extracorneal. This is again 21 report and 22. So there was a slight reduction from 2.9 to, there was a very minimal reduction in the size. But they say no significant, but with little bit changes we could see. So again, she started complaining of, in the due course of the treatment, she had severe dry cough, Shushka Kasa, Parshvashula. Because of the Kasa, she developed Parshvashula and Ardhava Bedaka. So it was very Tikshna Pitta and Tikshna Vata, Admana and Pindikodveshana. That catch was very bad. So again, it was managed symptomatically. We started giving Sitopaladi Churna with Swarna Sutashekara mixed with Muhur. So Shushka Kasa gradually reduced on giving these two combination Muhur. And again, the cough increased and red small mosaic pattern appeared on the thigh region with severe pain and catch in the leg. This was a further development in the case. So when we just took an X-ray, we noticed that there was an elevated right dome of the diaphragm, and it was causing that atelectasis of the right lower zone of the lung. Again, there was a down in the HB, it reduced to 6, and there was altered CBC values. ESR shooted up to 150. So again, it became a challenge for us. Like even after controlling, like she had a typical episode. In every November, the symptoms used to aggravate. Maybe because of the Rutu. Sharad Rutu, generally Pitta Vriddhi happens. So maybe we noticed that typical episodal attacks in the October to November time. So again, as I said, that ESR shooted up to 150. And her scan revealed her liver, which was enlarged up to 21 centimeters. So again, we started with Patola Katrohinyadi Kashaya, and a combination of Katuki, Nimba, Amrita and Brigaraja Kashaya was given. And because of that elevated dome and atelectasis of the lung, I started, and very pneumonitis. See, in this report you can see non-enhancing linear, non-homogeneous patchy opacities with adjacent minimal interstitial thickening of the right middle lobe of the lung. So based on this, I started her with Mahalakshmi Vilasa Rasa mixed with Grita. Mahalakshmi Vilasa Rasa is again a Shoshaka Dravya. It causes increase of the severe Ruksha Shushkata in the Deha. So to avoid that excess Rukshata, I asked her to mix that Mahalakshmi Vilasa Rasa with the Grita and also consume more amount of ghee along with the food. So these medicines were added. And this is the intermediate reports. So as I told you that after adding Patola Katrohinyadi Kashaya and Katuki Nimba combination, liver size reduced to 7.2. So further, Panchatikta Gugulugrita was continued along with Varunadi Kashaya, and Drakshadipaka was given as a Paniya. Drakshadipaka is a Panaka Kalpana with Draksha Kashaya, Shunti, and that Airavata and lime, Swarasa. So this I was giving her for Shirashula and Admana, which gave a enormous, remarkable relief to the patient. So after this course, like almost around 8 to 10 months of the treatment, we can see there was a significant reduction in the size of the lymphoma. So you can see in the report, compared to the previous scan done on 4/8/21, size of the left orbital lesion has significantly reduced from 3 into 1.5 into 3.2 to 1.3 into 1.2 into 2 centimeters. Even her eyeball, we could see when we see her face, that left eyeball had gone back. So that protrusion was considerably reduced. So this is one case of even though they say it is a low grade one, but symptoms were pretty high, and she had all other symptoms. Like, see, even though the mass was in the eyeball, the what to say, that dosha and vyakta lakshanas were all over the body. That pitta dushti and that guna analysis had to happen. So there was severe Ushna and Ruksha combination in the body. There was increase of Ushna Guna, there was increase of Ruksha Guna in the body. So she developed all those other symptoms. So the further that management, as I told in the earlier slides, this was done, and even the lesion reduced considerably. So now coming to another case, a male patient aged 41 years presented with hematuria, painful micturition. There was no other associated complaints. Patient was advised to undergo ultrasound scan, and the report of 13th February reported that left renal calculus with 3.3 mm in the lower pole calyx. Echogenic polypoidal lesions in the urinary bladder. Possibility of differentials, they had a differential diagnosis of malakoplakia and malignancy measuring 6.7 to 4.7. Sometimes what happens, like even after advising to your patient, even after telling them the problem with the biopsy, they will not understand. The fear is so struck, and even unfortunately, the other conventional system doctors whom they approach, they create such a fear, and they pose as though that is the only line of treatment. So even after telling him to not to undergo biopsy, excisional biopsy, the patient didn't listen. In this case, the patient underwent biopsy, but unfortunately, complete mass could not be removed because of excess bleeding. So here, the histopathological report suggested that it is a non-invasive papillary urothelial carcinoma, low grade. So here I thought, like, okay, Trivangavati is for Mutragata Vikaras. And again, as I said, it is a Rasayana Dravya as well as Lekhana Dravya. So I started with Trivangavati, Trivanga Bhasmavati, 1 TID in the Vyanakala. And I started with Sukumara Kashaya. So Sukumara Kashaya is again the major drugs are Punarnava and Trinapanchamula in that. I didn't choose Sukumara Grita here. Instead, I selected Sukumara Kashaya because I wanted that Rukshata. Apart from that Anulomana aspect, I wanted that Mutrala and Rukshaguna. So I selected Sukumara Kashaya. And along with that, the drug of choice, Varunadi Kashaya, again, Mutragata Vikaras, it is indicated. And Panchatikta Gugulugrita was given along with Shivagutika. So all the drugs, whatever I have selected here is, it acts on the Mutrabhasrotas and Basti, and along with the Lekana action and also the Rasayana effect. So this was given. So as I said, even after sincere advice of not going for biopsy, the patient underwent biopsy, and as I told you, unfortunately, the whole of the mass could not be removed. So it was a partial excision which happened, and which again triggered the mass to grow. So first, you can see, I have underlined, in the first report, it is 6.7 by 4.7 centimeter. After the biopsy, there was 3.2 into 2.2. But again, it started growing badly. It came up to 7 by 3.4. 7 centimeters by 3.4 centimeter, or 70 mm by 34 mm. So it was a bad decision of going this one. But only thing what we could help in this case is, we could stop the metastasis. We could not, like, with the continuation of the medicines along with this, we could not, we didn't allow the mass to grow beyond bladder, and it didn't metastase. So these are the various reports which shows like the lesion. And one more thing, see, you can see in the second report, 5 by 4 by 6.1. So it kept on increasing, and again 8.3 by 7.2 into 8.2 centimeters. But it started occupying the whole of the bladder, and it went to such an extent that the patient could not retain, like the irritability of the bladder started, and once in half an hour he had to void urine. So the patient also had painful micturition. See here, as the Trivangavati and Panchatikta Gugulu Grita was given continuously, after a month, we could see that small fragments of that mass. Again, it started growing, I told you. So those small fragments were seen in the urine. The patient took that sample and got it tested in the hospital. They said it is the mass, that lesion of the mass. So those were the fragments of the cancer tissue which was coming out. But only thing is, the treatment speed and the growth speed could not be matched. So even though there was a excision of that fragments along with the urine, the growth was also very fast. So he had to undergo cystectomy. So neobladder was put, and what we could see after the surgery, the biopsy was taken of the bladder. So whatever that lesion in the, here you can see in the report, features are of low-grade papillary urothelial carcinoma with focal high-grade areas. It is suggested. This is the histopathological report of the a small mass which was taken. But after the cystectomy, they said that the cancer remained low grade only. It did not have that high grade this one, and it had not grown its roots anywhere else. So it was only restricted to the bladder. So now the patient is stable with the neobladder, and there is no other lesions or any metastasis or any other remnants of the cancer cells anywhere in his body. So we could prevent the spread of the disease, and we could restrict that low-grade carcinoma to a low-grade carcinoma only along with these reports. So probably in this case, what I would like to convey is, if the patient had not undergone this one, partial excision in the initial stage, probably the fragments would have fallen like that only. Because of that fear and that the frustration created by maybe the family members and the doctors to whom he was approaching, unfortunately, things hastened up very fast before we could do anything. So this is one case. So here, the lesion increased in the size post TURBT. Probably the excisional biopsy increased the intensity of the growth of the lesion. Further adding on to it, the TURBT, the complete excision, as I said, of the tumor was not done, and recurrence and regrowth of the tumor was fast after TURBT. So, because of the continued medication of Ayurvedic system along with the conventional, we could arrest that low-grade carcinoma to be a low-grade carcinoma. So now the next case, patient approached with hematuria since 1 week, and he is a known case of bipolar disorder and was on Zolfresh and the other medications, Ecosprin, Lemit, Rose Gold, etc. Agitation, anger and hematuria were the complaints for which he approached me. So patient was advised Sukumara Grita 10 ml at bedtime, Mahakalyanaka Kashaya to calm him down. As he was a known case of bipolar disorder, we didn't stop any other medication, but to pacify that stress part and the frustration and agitation, we started with Mahakalyanaka Kashaya and Manasa Mitra Vatakam. And Sukumara Grita, because of the old age, and I have not mentioned the age here. So he is, I think, 60 plus or nearing 70. So I advised Sukumara Grita 10 ml at the bedtime. And patient was advised cystoscopy along with the biopsy, but patient strictly refused to undergo that and he continued the medications. But as there was hematuria, he was advised to stop ecosprin. So 14/6/22 scan was taken and they suspected bladder carcinoma because bladder wall thickening was 3 plus and patient was totally against biopsy and he didn't go. So later he approached us and I advised him Hridyarnavarasa. Hridyarnavarasa contains tamra. So again, a Lekana concept and he was stopped from ecosprin. So Hridyarnavarasa is again one drug which causes the vilayana of the Rakta Dhatu. So instead of ecosprin, as the doctors had stopped ecosprin, I advised Hridyarnavarasa. So it acts both the Rakta Nissaraka as well as Lekhana. And again, Shivagutika, Panchatikta Gugulugrita was advised. And we planned for one course of Shodhana. Snehapana with Arohana Krama with Mahakalyanaka Grita was selected. Here I selected Mahakalyanaka Grita not because of the bladder CA, but because of his symptoms, that frustration, agitation, anger and severe Vata Pitta Vriddhi. I selected Mahakalyanaka Grita and Abhyanga with Mahanarayana Taila and Virechana was given. After this, sleep improved, anger reduced to a very great extent and hematuria stopped. So further, Shamanaushadis, I continued with Varunadi Kashaya, Trivangavati, Chandra Prabhavati and Shivagutika. After Parihara Kala, I planned one Yoga Basti. Because see, in this case, it was very difficult for me to measure or analyze with the reports because patient was not ready to undergo cystoscopy. He was not willing to go for scan. So we had to treat him only based on the symptoms. So after Parihara Kala, I planned one Yoga Basti with Dashamula, Amrita, Punarnava, Eranda and Sariva. Purely Shotahara. So Dashamula is again Shotahara, Punarnava is Shotahara, Eranda is Vrishya and Vatahara, Sariva and Amrita to reduce the Pitta dosha. So this was the analysis done and planned the medications. So we gave around 600 ml of Kashaya along with Mahakalyanaka Grita as Snehadravya, Madhu 100, Lavana 12 grams, Shatapushpa and Pippali 12 grams. So Anuvasana Basti was again planned with Mahakalyanaka Grita itself. So after Basti, oral medications were given with Trivangavati, Sukumara Grita and Shaddharana Yoga. So Shaddharana Yoga, I had given this because it has Gomutra and that is also a Koshtavatahara line of treatment. So that was planned. So again, report was CT abdomen. We somehow convinced him and took a CT abdomen. So there was a small calcific focus at the bladder neck. Again, the other conventional system doctor suggested him with the biopsy and patient was very reluctant to go. So we didn't force him. So one more basti. So he was like stuck. Whatever you give in the Ayurvedic treatment. I am ready to take n number of bastis and n number of virechanas, but I will not go for the biopsy or any other system. I mean treatment procedures. So again in 23 Jan we planned one more basti with Dashamula, Eranda, Punarnava, similar Kashaya, but this time the Snehadravya was Bastyamaya Grita and Sukumara Grita. And I had included even Madana and Vacha in the Kalka Dravyas to cause that Lekana effect. And Anuvasana was given with Indukanta Grita, which is again a Kapha Hara Grita. So next again one more scan was taken, wherein he had also a prostatomegaly. There was a increased size of prostate, which reduced from 67.5 cc to 39 cc. And there was a mild diffuse bladder thickening of 8 mm. So that thickening had reduced. And again, that cancer suspicion, what they had put, was not there this time. So prevoidal urine was 292 and postvoidal was 141. Further, oral medications were continued, as said earlier. And so these are the two reports. The earlier one, which suggested that 67.5 cc of bladder, prostate megaly, and a small calcific focus noted at the neck of the bladder. So all these things, and the current study, after the treatment, 31,723, which I have taken. So you can see urinary bladder, bilateral vesicoureteric junctions are normal. So the bladder wall thickening had completely reduced. Hematuria-like symptoms had stopped earlier only. Post Virechana, first course of Virechana only, we could see a very dramatic reduction of the symptoms. And along with, because of these Panchakarma procedures, he is out of all his bipolar medications also. So he is only on some of the Ayurvedic medicines, which I will tell right away. So again, what we saw was in the last previous scan from 67.5 to 39, it had reduced. Again, it shooted up to 70 cc. So this was again a headache with an increasing PSA, prostate specific antigen also increased. Later, in this case, I added Veerataradi Kashaya to reduce the size of the prostate, and even the prostate specific antigen PSA also reduced from somewhere around, it was 13. After adding Veerataradi Kashaya, it reduced to 6. So now he is still on medication with these two, Punarnavadi Kashaya and Veerataradi, along with Sukumaragrita once at bedtime. So now patient is stable without any other allopathic medicines. He is completely on Ayurvedic medications for all his other problems. So these are the case presentations which I have done so far. And I would just like to give a brief message or information about these medicines, what we usually use. So Panchatikta Gugulu is again a drug of choice. It is made of Gugulu, Katuki, Ativisha, Indrayava and others. So even though it is advised, generally, most of the doctors, we use Gugulu Tikta Grita for the Snehapana in psoriasis, skin disorders, arthritis, rheumatism, etc. and even spine related. But this is again a drug of choice in most of the cancerous conditions because it is an apatarpaka grita and a shoshaka grita. Even though it is grita, it has that unique shoshana effect and lekana effect also. So, and yeah. Next is one more thing. I usually select Atimadura Churna for Kshirapana in many of these cases because see, most of the medications cause severe refluxes and burning sensation, pain abdomen. Patient complains of such conditions in the management, during the course of the treatment. So usually I do this Atimadura Kshirapaka. I give, I take that Yadavji Trikamji Acharya's Kshirapaka composition, 1:15:15. So one part of Atimadura Churna, 15 water, 15 parts of Kshira, reduced to 15. So it is a very easy preparation we can advise to the patients. So, and it acts as a best antacid ever than any other medications and very safest. It's a single drug management. Again, Indukanta Grita. So it is indicated in the gastrointestinal and acid peptic disorders. So again, you have to consider the dosha, the dushyas. So whenever there is a kapha pitta vriddhi, whenever there is a gut related issues, this is my drug of choice. So based on the patient's condition, I usually take it as a Shamanaushada or as a Shodhananga Bhuta Sneha. Both I plan, and even in the respiratory conditions also I gave this. And Mahapanchagavya Grita is one such things where it is a very good drug. So even in Manasavika, it is again, it's a direct indication for Manogata Vikaras. Along with that, again, as it is a Lekana Dravya, it also can be used in the most of the cancerous conditions based on the Lakshanas. So here it is made of Dashamula, Trifala, Panchagavyas, that is Gomutra, Gogrita, Gomaya, and all those butter, everything that panchagavyas, trikatu, turmeric, anantamula, pushkaramula, etc. And Trifalagrita is one thing, and one more thing I wanted to say in that that case where she had B lympho, low grade B lympho lymphatic non-Hodgkin's lymphoma, we advised Tarpana also. One course of Tarpana also we advised with Trifalagrita, which also helped in the reduction. Again, it helps in hair growth. Netra Tarpana is very beneficial with this dravya. And I mentioned about Drakshadipaka. So this is the Kashaya of Draksha with Swarasa of Shunti, Nimbuka and Airavata. It is a proprietary product, but wonderful. Like it acts whenever there is a necessity of domperidone effect. Andre means like the gut, it has to push the contents into the intestine. Domperidone does that effect only. How it reduces vomiting means it just pushes the gastric contents to the intestine. This has a very similar effect. So I use this in very high reflux cases also. In some of the autoimmune disorder where there is severe reflux, instead of domperidone, we can supplement with Drakshadipaka. So in any of the cancer treating patients wherein there will be severe gastric reflux or severe acidity, severe burning sensation, we can go with this. I usually give this as a beverage, means quarter part of syrup with 3/4 part of water, make it into a glass of juice like and sip often. So apart from this also has an indication in hyperemesis gravidarum, and we usually give it in pediatric doses also for as a digestive syrup. So this unique thing which helps us to manage most of the associated symptoms in the cancer patients. So this is my presentation and this is my small contributions towards. We have many of the other cases also, but which has a proper documentation, I wanted to bring it. And there are certain things where in some of the cases wherein we have started in a very early stage where the patient approaches us first. In such cases, we have found a very remarkable change and we are able to arrest the condition. Means the samprapti vigatana has to happen. So we are able to arrest the samprapti at that particular stage and control the disease, check the disease. So this is my small contribution towards the cancer. So further to Dr. Shakuntala Patil, madam.
Thank you so much, ma'am, for wonderful presentation. Shall I take some questions?
Yes, I still have half an hour time, we can take.
Okay. In the chat box, if you have any queries, you can raise the hand so that one by one you can unmute and ask the question directly, or else I'll read out in the chat box.
Madam, you can take out your screen, ma'am.
Okay.
Sharing this, so
One
it will
second.
be,
Yeah.
And it is excellent presentation. Actually.
Doctor,
Yeah.
Dr. Ashwini is asking,
Yeah.
how to prepare Drakshadi Paniya?
Drakshadi Paka, which I said now, that is a ready available preparation in the market. You just have to add quarter part of the syrup and mix it with any measure you take. Suppose you take a, yeah.
Dr. Kavita, mute your gadget.
Okay, so this is the confusion. So in a glass, just prepare quarter part of the syrup and add 3/4 part of water and mix it well. So that becomes a juice. That is the Drakshadi Paniya which I give. This is a ready available medicine in the market.
Dr. Rajneesh is asking, Trivangavati and Shivagulika ka anupan kya hota hai?
Okay, Shivagutika, I have given it Ushna Jala. That is the only Anupana I have taken. And Trivangavati, sometimes I have given it with Madhu, honey, and sometimes just gulp it with water.
And Dr. Kimaya is asking, please tell more about Trivangavati.
Trivangavati is nothing but the Trivanga Basma. So, giving the Basma forum, it is very difficult for us to fix the dosage to the patient. We have to mix it with something else. So I just selected the Trivanga Basma Vati. That's all. It is nothing else. It's a Basma Vati only.
Mahakalyanaka Kashaya reference.
Mahakalyanaka Kashaya is the Kashaya part of Mahakalyanaka Grita. Reference Charaka. Charaka Samhita Unmada Chikitsa. Ekavimshatika Grita. That one only.
Okay, thank you, ma'am. Any more queries? Dr. Shubhamangala, ma'am.
Madam, namaste. I would like
Namaste.
to share my experience with Rakshadipaka. It is excellent in pregnancy care. So, any nausea, vomiting, Rakshadipaka can help well. So, I just wanted
Thank you.
to give my opinion.
Ma'am, can you suggest Ayurvedic approach to thyroid lesions?
Thyroid lesions.
Hmm.
See, I have treated few of the thyroid cases. See, again, if you see it as a thyroid, your approach differs. If you see it as a Rasapradosha Javikara, your approach differs. So, if there is just a mass without any other symptoms, I usually advise Lepa here with either Atimadura or Trifala Churna mix, and I will just apply Lepa, and I will plan the Shodhana. Virechana, I usually plan Shodhana in such cases, and the size reduces. In Snehapana itself, we can see the reduction of the size.
Benign prostate megaly treatment.
Yeah, PPH, as you all know, like there are a lot of available. Varunadi Kashaya, I give Gugudu Tikta Grita, I give. Based on the symptoms, I plan, but usually this is the drug of choice. I give even Trivangavati also. As I said in this case, the last case which I presented, none of the medicines like Sukumara Kashaya or anything worked in that case for treating that prostate hypertrophy. So I had to give him Punarnavadi Kashaya and Virataradi Kashaya, which helped me reduce the size. And even after one course of Basti, the size remarkably reduced. And we have to check even the PSA also, that if that keeps increasing, that is again a sign of alarm. The patient may go on to a cancerous condition. So that also has to be checked. So I usually plan with these things: Punarnavadi Kashaya, Virataradi Kashaya, Varunadi Kashaya, Sukumara Kashaya. So, or sometimes even Panchatikta Kashaya. Based on the condition and based on the symptoms, I usually select with these drugs.
Thank you, ma'am. Dr. Venkatesh is asking, patient age 32 years, repeatedly urination sometimes, burning and uncontrolled urination in morning sometimes. All reports are normal. What treatment we can give in such cases?
Best way is to plan Matra Basti. It helps enormously. Currently, one more paper is in the peer review of similar thing, but it is post-hysterectomy. Probably in a month or so that will be published. Planning Matra Basti in such cases, especially with Sukumara Grita. Sukumara Grita retention will be tough because it is it's a Yamaka Sneha with Ereda Taila. So either you can plan Vastyamayanta Grita or Indukanta Grita. So you plan Basti, sir. You plan Matra Basti. You start with a very basic minimum quantity of 30 or 40 ml and then raise up to 60 ml depending on the capacity of the withholding. It will have a remarkable effect on the bladder condition. I have treated many cases wherein there is, you call it as urogenic bladder, right? Wherein that irritability is too much. So plan Matra Basti, it helps you very much. And even that Mamsapachaka Kashaya also I give sometimes. Mamsapachaka is a reference from Charaka Vishamajvara Chikitsa. So that actually acts on the Mamsa Dhatu. So that also you can plan. But Basti helps to a very great extent.
Thank you. Treatment for supraclavicular lymph node mass. Treatment for supraclavicular lymph node mass.
Supraclavicular lymph node mass occurs to various conditions. Even in a toothache, it can come. Sometimes even in severe cold or cough or some pharyngitis also it comes. So we need to see the symptoms. It is not just a lymph node I am treating. We are treating a patient as a whole. So always analyze the lakshanas, dosha, dushya, samprapti, and then give. It is not the mass we are treating, it is the patient.
Dr. Savita is saying, how about usage of castor oil in reduction of lesion?
I have not used, doctor, so far. Depending on the case, we may, but I have not used so far.
Any one cancer treatment use for Panchatikta Grita Gugulu? Question is incomplete, I think.
No, in all these cases, I have given Panchatikta Gugulu Grita.
Yes, yes. Okay. Shakuntala ma'am, you can ask.
Madam, good evening.
Good evening, ma'am.
I'm Dr. Hemalata from Udupi.
Huh.
One of my patient, 42 years male, the same right supraclavicular hypoechoic nodular lesion. In scanning, it showed irregular cystic areas, 49 into 44 into 32 mm. Query infective, query neoplastic etiology. FNAC was suspicious for malignancy. CT query infected lymphangioma or necrotic lymph nodal mass. What to do, ma'am?
Okay. There you are asking for supraclavicular mass. Madam, can we consider this
No
as
lung
Kamala?
pathology. CT, no lung pathology.
Okay. Yeah, something like we can plan with Kanchanara Gugulu.
Okay.
We have to try, ma'am, because I have not seen the patient. Based on the report, what you are telling, I'm just giving you a suggestion.
He is diabetic, occasional alcoholic, and has tobacco chewing also. No other mass or no illness, like only lymph node is there. That is of a small lymph node.
You can try with Kanchanara Gugulu and Mahatiktaka Grita as a Shamana Sneha. Try, ma'am. Try this and see.
Okay. Thank you, ma'am. Thank you very much.
Yeah.
Thank you, ma'am. Dr. Purnima is asking, endometrial CA grade 1 post-surgery, what can be given for avoiding reoccurrence?
Endometrial carcinoma grade 1 post-surgery. What surgery? Patient has underwent hysterectomy?
She has not mentioned. Yes, hysterectomy.
Okay. Check for metastasis. PET scan has to be done. But endometrial carcinoma is like it spreads very late. It is not a very fast growing cancer. It takes too much of time when compared to cervical cancer. So if there is no metastasis, then see there again, I have also treated one endometrial CA case. But I used the same, like we have Shatavari Rasayana from our pharmacy. As a maintenance dose, I give Shatavari Rasayana 1 teaspoon on empty stomach. That is one thing. And again, Mahatiktaka Grita as well as Mahatiktaka Kashaya, I was giving in that case, wherein endometrial CA and hysterectomy was done. So based on the symptoms, like you can plan. If there is no metastasis, then maintenance becomes very easy. But long term, see, Gritas are like a drug of choice in cancer management. So more and more deeper the disease is, you plan with Grita, the approach is more easier. And of course, you have to convince the patient for Grita consumption, but certainly it helps a lot. Ma'am, I'm unable to.
Hello. Hello.
Yeah.
Sorry. In that same case, brachytherapy is required?
I don't have idea, madam. I have not given that. This is what is my treatment.
Okay. Ma'am, can you explain treatment for osteosarcoma?
Sir, again, I'm on and on telling you, don't see in those lines. If you see in those lines, you are bound to err. Check the symptoms, analyze the symptoms, analyze the doshas, then plan. See, of course, osteosarcoma, asthi sandhigata vikara, one thing you get into mind. But go for the lakshanas, how the patient is presenting, what the patient is telling, then you plan.
Okay. One more. Patient aged 88 on palliative treatment for uterine CA, diabetic case, now complaints of Chardi. Instead of Dadima Paka, what can be suggested?
In such case, we can give Drakshadipaka, which I told. You said diabetes, right? Patient is
Yes.
diabetic, but 88, see, 1 spoon of Drakshadipaka has around 1 or 2 grams of Sharkara. That doesn't matter much. You can give it as a paniya. You can give it as a paniya, or else even Sutashekar Rasa also works very well. Just powder 1 tablet of Sutashekar Rasa and ask them to lick very slowly. That also reduces Chardi. But best is, as I said, Drakshadipaka works wonderful and it doesn't increase. See, we should not think in those lines. It increases sugar levels just because it has sugar. In many things, what we consume has sugar. So a proper controlled administration doesn't hamper much. So give it as a paniya, nothing will happen. But under observation.
Dr. Ishwar, you can ask the question.
Just I sent the message, ma'am.
Okay.
Madam has answered for me.
Shakuntala ma'am, you want to ask something?
Yeah, my question is like regarding Mamsapachaka, ma'am. So wherever all you are using Mamsapachaka question, Mamsapachaka Kashayam.
Where I am using
Yes,
Mamsapachaka.
because as all the cancers are involving in Mamsadhatu mainly. So so are you jumping into directly Mamsapachaka or
no?
so
No, doctor. No, doctor. If I feel there is a direct involvement of Mamsa Dhatu in particular, then only I take Mamsa Pachaka Kashaya. And all like Rasa, Rakta, Mamsa Meda, everything. Depending on the condition, I just take that. Not in all cases, not necessarily.
Okay. Yes, thank you. But because usually these questions comes again and again when the patients are approaching. So that is the thing. Yeah. Thank you so much. And one more thing regarding endometrial carcinoma, one madam has asked Dr. Purnima, I think. So day before yesterday, I had given one patient which has actually diagnosed 6 months back only. Because of fear, they have not turned up, and she quite. Since 2 years, she was having bleeding. She is not at all approached to doctor after menopause. This is the thing. And she approached 2 days back. I have started with Abhayarishta and Shivagulika and Kanchanara. Initially, as she is going for, we have taken MRI. And MRI is, so as you said, it is not fast growing. It's true. And it is within the uterus only. I have suggested for hysterectomy. Because she is having repeated bleeding. So
yeah, I also add Kushmanda Rasayana in such cases. Our Kushmanda Rasayana, we give a bhavana with Vasa. So so Vasa Swarasa bhavana we give. So our Kushmanda Rasayana again helps in reducing the heavy uterine bleeding.
Yeah.
So that also has a check. So this is also one point which I wanted to add.
Yeah, thank you so much. Now we are telling about Mahatiktaka Grutam and Panchatikta Gula Grutam. So actually later after the post surgery, because she is now I have given combination of Sitopaladi and Talisadi because she is having the long history of wheezing where the Rasadhatu forms correctly. So I have given add-on to that. I have added Lodra Manjishta and Musta to it. So yeah, this is a combination. Just one more doctor asked her, so I wanted to share this. Yeah. And one more thing I want, and regarding Erenda Thaila, one doctor asked, I'm giving Erenda Thaila in fibroadenomas. So as a pichu, and even in hernia also I'm giving pichus, and it is giving excellent result. And yeah, in the intake, like we can give usually this Veena madam's best practice in her this thing. So as a Shodhana, she will add Erenda Thaila along with so if it is kapha, only Erenda Thaila along with sometimes with the Triphala Kashaya, or only Eranda Taila. If it is Vata, then she will add with or milk in cancer cases only. So like Pitta along with milk, Vata along only Sneha. Like that she is giving. So that is giving excellent result in her practices regarding Eranda Taila. Yeah. Thank you, ma'am. Please
Thank
continue.
you. Dr. Anand sir is saying, according to info, sugar contraindicated in cancer. Then you are using that Drakshadi Paka and all, no? So that's why
Yes,
you
no,
might have
even I accept that theory, because any santarpanota ahara or aushada will cause santarpana to the cancer also. So usually we select apatarpaka line of treatment in such things. But because of that severe regurgitation, as I told you, it is a very minimal quantity of sugar, and that should not hamper. Like in day-to-day activities also we consume many times. So when we consider that, just 1 or 1.5 grams of sugar in one dose is okay. Like that.
Madam, why not Draksha Kashaya?
Ma'am, sir?
Why not Draksha Kashaya instead of Draksha Paka?
No, we use Draksha Kashaya only to make that Panaka Kalpana and making it more palatable, sir. And Draksha Kashaya also can be given. I'm not negating that, but I just told the benefit of this medicine, that's all.
And it is very tasty, sir, Anand sir. And we have tried, we have taken that. And it is excellent drug of choice in chemo, where the patients are without, as madam said, it is without diabetic. Diabetic also we can give. Without diabetic also we can prescribe. And patients are coming to our in general practice. No, there also we can suggest this Drakshadi Panaka. It is excellent, sir. I am using.
Any more questions? Yes, ma'am. Dr. Neelima. Dr. Neelima.
Hello, I'm a Shalakya person, and I have one patient with renal cell carcinoma in the nose.
Ma'am, can you be louder?
I have a patient.
Huh.
He has got renal cell carcinoma.
Okay.
That is in nose.
Huh.
And he's having epistaxis and recurrent removal we are doing. We are
Recurrent?
doing removal, face surgery we are doing, face.
Okay. Huh.
And it is coming recurrently, renal cell carcinoma.
Okay.
So what do you suggest for that?
Ma'am, have you tried any Tikshna Nasyas and such things?
No, we haven't tried. We are just doing nasal douches with trifila.
Okay. Why don't you try with either Anutaila or Shadbindu Taila Nasya? Even Pratimarsha is okay.
It becomes tikshna for him because it bleeds.
Okay.
It bleeds like epistaxis.
Oh, okay. When it is Tikshna, I usually take the concept of Basti and I do. Like I usually alter with Kshirabala and Anutaila. Sometimes when the patient cannot handle that Tikshna Gritas, when they cannot take that Shodhana Nasyas, I usually alter with Shamana Nasya. Like one day I give Kshirabala, one day I give Anutaila, like that. We need to try and see, ma'am.
Because there are atrophic changes are going on. Scabs are forming inside the cavity where the clearance is going on.
That is place where the Thaila or Sneha Dravya helps, no ma'am. We can try that. Anyway, I have not seen. This is what I just gave an opinion. That's all.
Yeah, Shadbindu locally you mean, and
Yes. Just 1 or 2 drops, which Pratimarshanasya, I am telling.
Yeah, and internally?
Internally, again, what are the symptoms what he's showing apart from this?
Only epistaxis, and that's all. That was the only symptom he came with.
Okay. Ma'am, you can try this Kushmanda Rasayana also, Mahakushmanda Rasayana, which I said it has Vasa Bhavana. Again, it is in the Vasa is indicated in Rakta Pitta. This Mahakushmanda Rasayana, we give it in Urdhva Chaturgata Vikaras also. So in Pratishyaya, Pinasa, Kasa and all we indicate. You just try this, ma'am, as this has Vasasvarasa Bhavana. So this epistaxis can also come under control.
Yes.
And Kshirabala Taila Pichu.
Okay. Yeah. Thank you.
Yeah.
Dr. Srinivas. Dr. Srinivas, you can ask. Anyone wanted to ask any queries? I think you have cleared all the doubts, ma'am. Really, it was excellent presentation. Now I request Dr. Geeta Jaiswal to give a vote of thanks. Over to you, Dr. Geeta Jaiswal.
Pratisaraniya Nasya can be given, sir. Pratisaraniya Sneha you had mentioned, right, sir?
Yes. That can be given.
Yes, sir. We can do it. In many polypoidal conditions, I have tried with Pratisarana, and it has a reduction in the size. So in CA also we can try, but I have not got any cases in that. We can try certainly. It is harmless, no, sir. We can try.
Okay. Ma'am, you want to ask anything, ma'am? Shakuntala, ma'am.
Yeah, I thank Ranjini ma'am. It is very nice presentation, and with the depth how we have actually see the disease, in what manner, how we have see the dhatu level and other things are very excellent. And along with that, actually I noticed in previous seminar also I was noticing, like, you are comparing with other system of medicine, how they are also diagnosing, how you are correlating with allopathy. So that is also needed for the hour actually. And thank you so much. And your knowledge is uncomparable. It's very nice one.
It's very minimal.
Thank you so much for taking your time to come here and share your knowledge.
Yeah. Thank you. Thank you.
One more case is there. One more question is there. Role of Amruta in cancer prevention.
Amrita is again a rasayana dravya. Yes. See, Amrita Guduchi, he has explained it as a shaka. So you can use it as a ahara dravya. When you mix many of the greens, you can add few leaves of Amrita and use it as a shaka. So it is a satmya dravya only. So certainly you can advise. Preventing cancer, again, we have to do lot of trials and all. Yes, but as he has advised it to use it as a shaka, it can be taken.
Post-cancer surgery maintenance.
Depending on the condition, madam. See, as I told you, any day use sneha. Use snehas. Because grita, it has a very huge impact. And all that guda vyadis means which has taken depth in the dhatugata avastha, but for gritas, nothing else can bring it out. This is what is my experience of 22 years. So using grita helps you control or manage many of the such type of disorders. So based on the condition, based on the sthana, vyakta sthana, select your grita and put it as a shamana sneha. It helps you very much. I have used Rasaushadis pre and post. As I mentioned, I was using Swarnamalini Vasanta. I'm using Trivanga Basma, Suta Shekhar Rasa, Yogendra Rasa, Siddhamakara Dvaja. I am giving. It certainly works.
Sure, ma'am. Thank you. Thank you so much. Dr. Geeta Jaiswal.
Yeah. I'm audible?
Yes,
Yeah.
Okay. Good evening, everyone. It's my honor to extend my heartfelt gratitude to our distinguished speaker, Dr. Ranjini Karthik. Her insightful, the impactful presentation on cancer was really awesome. Your expertise and dedication was amazing. It is really visible in all the cases.
Thank you.
So your knowledge, your contribution has inspired many of the youngsters, doctors, whoever I've heard here. So thank you for sharing your knowledge and passion with us. We ROS team are deeply appreciative for your time and effort you have invested.
Thank you, ma'am. Thank you so much. Thank you for giving me an opportunity to interact with all the senior Vaidyas. Thank you so much.
Ma'am, before leaving, one more question.
Yeah.
After radiation,
Huh.
just a minute. After radiation, patient feel burning. Lot of disturbance.
Burning?
Just a minute. Burning, what we can give internally and for local application.
Local application, Ksheerabala Taila helps very much in burning reduction. And if it is too much, sometimes I give even Tapyadi Loha. Tapyadi Loha I give, and again, my drug of choice, Sneha. Either you select Mahakalyana Kagrita. Sometimes I just give 10 drops. Just 10 drops with milk pacifies so much. You just have to target it. Check for the Agni. If Agni is good, Mahakalyana Kagrita. If Agni is not that good, then go for Mahatikta Kagrita, which is more lighter, or Indukanta Grita. Indukanta Grita also reduces burning sensation. It is specially a Pitta Shamaka Grita. So internally you can give Indukanta Grita or Mahakalyana Grita based on the Agni, and external application Ksheerabala Taila. And even as I said, Tapyadi Loha.
Thank you, ma'am.
Yeah.
Thanks for wonderful presentation. Thank you.
Thank you, ma'am. Thank you so much for giving me the opportunity. I thank all the organizers. Thank you so much.
Thank you.